and welcome to OPCA's planning call for National Health Center Week. We're really excited to have everybody here. My name is Carly Hood. I'm the Policy Associate at the Primary Care Association. And joining me in the room is Rivka Labrodsky, Policy Coordinator. So before we get started, just a couple of housekeeping items. We are recording the call to be able to share it out with folks who can't attend afterwards, so any questions and comments will be recorded. You're going to be muted during, I'd say, the first 20 minutes of the presentation. I'm going to walk through kind of some high-level thoughts on National Health Center Week from the state level, but then I really do hope to have the majority of this time be kind of tossing ideas out, planning and discussion related, so at that point we'll unmute you. If you have questions throughout the presentation, feel free to submit those in the chat box, and again, we'll unmute you when it's time to kind of have a dialogue.
And then if you're having any audio trouble, we have a few options listed here. So if you can't hear or something happens while the presentation is going on, the best option is to log off or hang up and restart. Or select a different listening option. You can also use the chat box to let us know if you're having issues. And then there's also a link here if none of those other options work for you. And we've gone ahead and posted that in the chat box so you can refer to it during the presentation.
Great. All right, so today I'm going to kind of share with you NAC's resources and talk through the themes and the content for National Health Center Week this year. We're going to talk about some tips for success to make sure that you feel equipped to plan any sort of event or any sort of acknowledgement of your health center for this week. And then, like I mentioned, we want to spend the bulk of the time kind of hearing from you all in terms of either what you're planning, what you're considering planning, and kind of just have a space to collaborate on that. And then, of course, I'll leave some time to ask questions and kind of hear a little bit more about how OPCA can help support you in this. Okay, so National Health Center Week this year, this year's theme is America's Health Centers, the key to healthier communities. And so NAC has put together a wealth of resources and has really tried to culminate the energy with PCAs, primary care associations across the country, and encouraged us to work very closely in partnership with all of you as you develop your events. So this is the theme they've chosen, and there are a lot of resources I'll share that can help advertise this. This year, there are 7 focus days for the week of August 13th through August 19th, so that's the official Health Center Week. The first day is Sunday, August 13th, that's Elected Officials Day. The second day, Monday, is Health Screenings Day. Tuesday is Public Housing Health Centers Day. Then Wednesday is Healthcare for the Homeless. Thursday is Agricultural Worker Day. Friday is Consumer Board Member Day, and then Saturday is Children's Health Day. And these are really just meant to provide, if you have some sort of event or content area that might align with one of these, it's a good day to really call attention to that. NAC and other PCAs and clinics across the country will be focusing on days. I will say that we don't necessarily need to focus on these days. If you have an event that falls outside of these topic areas, or an elected official comes to your event not on Sunday the 13th, that's totally fine. And in fact, NAC has recommended if you can't make an event this particular week, but sometime in August you can plan an event, that typically will count towards National Health Center Week events. So there are, I've heard of all kinds of things happening across the country. NAC has kind of shared what they've heard different health centers planning, but you can really make this your own event or your own program or your own way to advertise and share the uniqueness of your health center. There's no structure, but I did want to provide just a couple of a couple of ways that you could plan events. So some folks are having open houses. They're allowing folks to kind of tour the clinic. They're inviting neighbors or patients to come visit. You can show appreciation for local officials. So I've heard of a couple health centers that are planning events to support police and firefighters in the area. You can honor staff. So having a luncheon, really celebrating all the efforts that the staff contribute to health centers throughout the year is a great way to also bring recognition to your health center. Some clinics are offering free screenings, and so they're using this as an opportunity to advertise what the clinic does at large, but also providing a free service. And I know Central City Concern has last year, and I think this year as well, I hope Paul's on the phone to speak to this eventually, but some health centers are really focusing more on kind of the media side of things and not necessarily planning events, but planning blog posts throughout the week. And that's totally fine and something that we at OPCA want to be able to highlight as well. Some folks are having ceremonies. It might be a new clinic opening or breaking ground somewhere, so there's kind of an official ceremony, and that's often a great place to also invite a legislator to attend. Contests are always fun, getting kids roped into kind of fun events, and those can go alongside any of these other events as well. I mentioned groundbreaking or ribbon cutting for new clinics. And then I think Virginia Garcia in the past has done some great work with health fairs, and I hope that's also something that someone from there can speak to on the line. But having a health fair maybe where there are free screenings or you know, access to brochures and pamphlets and things that really share and advertise everything you do at the health center. And then NAC is encouraging clinics to collaborate with other local organizations. So if there's a way to kind of align this with what the local library is doing, or maybe the local police officers or firefighters are doing something, this is a great way to, again, make it a bigger kind of community-wide event. And I'll say with any of these, it's always good to invite elected officials. I'll talk about that a bit more in a moment. But planning to both invite local, state, or federal officials and planning to post all of this to social media is a great way to share what you're doing nationally. So a couple of tips for success. Again, inviting lawmakers and elected officials. So the timing is good for this. Congress is in recess. The state session has closed, and folks are really interested in getting back out into the community. So this is a really good time to say, hey, we have this thing happening. We'd love to have you come tour the clinic and participate. I have sent save the dates to all of our state legislators and to our congressional delegation, and I'm actually starting to hear back from some of them, including Senator Wyden. So some of them are saving the date, they're holding it, and they're just waiting for us to kind of let them know what events are happening. Once we have all of those scheduled, I plan to follow up with those folks that have reached out to OPCA. So that's another good reason to let us know what you're planning, because we can help connect your local, state, and federal officials with your clinic. You can also feel free to send invites. So that's a great way to establish a relationship. Again, we'd love to know if you've reached out to anyone so we can help support that, but we definitely encourage you to send invitations to any of the officials that you'd like to have there. And we encourage you to start now and to be persistent throughout the summer until the National Health Center Week events occur. This will encourage them and remind them that events are happening. Being flexible is key, so again, making sure that you've planned to the best of your ability, but things are going to come up. And also, as you're inviting lawmakers and elected officials, if they can only come on a certain date or a certain time, trying really hard to make it work with their schedule will behoove you in the long run. And then the only thing I'll mention is paying attention in regards to being careful with lawmakers and elected officials is paying attention to the timing and rules. So campaign events, if someone is campaigning, you're not allowed to associate that with National Health Center Week. And most of you probably know that, but I just wanted to call that out. So once you've planned your events, we hope that you'll post your events. NAC has this wonderful National Health Center Week website that I'll post at the end of the webinar for you to peruse. But we'd love for you to share your events there and with us. They have a map of the country with a ton of states throwing in all of their community health center events. And I'd love if Oregon can be well represented on that list. And then, again, letting us know if you're planning events and want us to help kind of connect you with lawmakers. So starting today is a great time to start advertising the fact that Health Center Week is August 13th through 19th on your social media. So OPCA is trying to kind of advertise this as a network as well. You should feel free to repost what we post or create your own posts. And again, this National Health Center Week website that I'll share with you really does a good job of sharing photos you can use and coming up with language and hashtags that are valuable. So you don't have to recreate the wheel. It's very easy to kind of cut and paste. NAC is also running a picture and video contest again this year. I believe winners are entered into a raffle to attend CHI to have that paid for. So, of course, we want all of our health centers participating and sharing pictures and videos of what it means to be a unique health center and represent the work you do. So Wednesday, July 19th at noon, NAC will be going over kind of what this picture and video contest entails, what the prizes are, and how to enter. So I'd encourage you to RSVP at the link at the bottom of this page or this slide, and we'll plan to be on that call as well. So 5 steps to success with your event. The first is planning, so start early. I think being on this call, I know some of you have already reached out and have begun planning, which is fantastic. But even if you haven't considered it yet, being on this call is a great first step. And from here, you should be able to kind of move forward. You want to determine the type of event you'd like to hold and create an invitation and sponsor list. So if you want anything sponsored, you know, thinking through who in your community might sponsor things and then who you'd like to invite is great. Second, create a team to implement this and execute it. From everything from the planning to the end of the week, it's helpful to have more folks on board. So consider creating a community, working with local partner organizations, and make sure that you have board and leadership support as well. Outreach is next. So again, I've mentioned this before, invitations to local, state, and federal elected officials, pardon me. Seek sponsors, so start with a list of folks in the community who might be interested in sponsoring events if their name is advertised, and begin getting the word out. And don't forget media as well, not just social media, but using your TV, radio, newspaper outlets. Those are great places to advertise that you're going to be holding an event. Persistence is key, so creating a timeline to continue reaching out to your local officials and your state officials, the media and other invitees that you want leading up to the event. That'll ensure you get the most people there as possible. And make sure your communication plans include regular updates for sponsors, attendees, and the public. And then, of course, at the end, you'll want to send thank you notes, notes of success, so what was accomplished, and thank you notes to those who attended. That's a great way to kind of close the loop and continue to build relationships with your community and your local elected officials. So with that, I'd like to spend most of the time now opening it up for folks to share what they're planning or what they're considering, to ask questions. I've heard from Wallace Medical that they're planning an open house the evening of August 15th, and they're inviting a plethora of local neighbors to their newish clinic in Gresham. We have one of their state representatives already interested, and I'll be reaching out to her soon to get that on the calendar. I know Neighborhood Health and Central City Concern have also reached out with events or actions that they're planning, and I'm hoping Penny or Paul will want to share what they're thinking about there. So we'll unmute you, and we're just here to kind of create this space for us to think as a network about what it is that you're thinking about planning or what you've already got in the works.
And the people that are supportive are, you know, that's great.
Yeah.
But we need leadership to be supportive too.
Yeah.
So we've gone ahead and unmuted most of you, but if you're talking and we can't hear you, go ahead and press *6 to join the conversation.
So maybe I'll pick on people because I can see you all. Let's start with Penny. Are you on the phone? Because I know that you've planned.
I am, Carly.
Hi, Penny.
Hi, how are you?
I'm good. How are you?
Good, thank you.
Would you mind sharing with the group what you all are planning?
Oh, I don't mind at all. We have 2 health fairs planned on Wednesday the 16th. We'll do a small one with about 5 to 10 booths in Canby at the small clinic we have there. And we'll have a dental van there offering dental screenings. And then we're going to do another one on the 17th at our Tannisbourne clinic, which is the one that's medical and dental combined here in Hillsborough. And we hope to have about 15 or 20 booths there. We've reached out to a lot of the organizations that we have partnerships with. So Project Access Now, LifeWorks, Impact Northwest, Northwest Family Services, Providence Community Resource Desk, all of them will be participating as well. And we're going to we've reached out to a farmer's market or a farm that's going to put up a farmer's market stand, and our goal is to get all of the participants to go through and have their cards stamped to see all of the booths and get glucose and blood test, blood pressure testing, glucose testing, and we're going to offer sports physicals, well child visits, and other ideas, other things around. And once they get them all signed, we hope they'll take that to the farmer's market booth and get up to $10 worth of free produce.
Oh, that's great. That's super creative, too. I like that a lot.
Yeah, thanks. We're kind of excited. I mean, we've got a lot yet still to go, and we do definitely want to bring officials here. In our Tannisbourne clinic, because it's new in the lobby, we have partnered with PCC Rock Creek and one of their professors there, a professor of art, and she teaches a mural class, and the mural class will be donating a mural, and it'll be placed on the wall in the lobby here. It's kind of a cityscape, and it'll be put on the wall on the 16th, and on the 17th we'll do an unveiling and a small reception during the lunchtime. And we're obviously wanting elected officials and the PC staff and the students and sort of acknowledge and have a nice little small but event to recognize the students and their participation on the wall.
Wonderful. Ooh, you guys really have 3 events.
Yeah, kind of. Yeah, I guess you're right. I think if the reception is part of the health fair, it'll sort of all work together on the same day. But yeah, you're right. It is 3 different ones.
Great. Thank you for sharing.
You're welcome.
Does anyone have questions or anything they'd like to share?
This is Casey from Virginia Garcia.
Hi, Casey.
Hi. One of the things that we're doing that we're finding is really important this year is collecting stories from people who have, experienced Virginia Garcia or experienced a community health center in general. And so we are setting up a table at our health fair that will collect stories and encourage people to provide us with their stories. And we have a private room where we can take them and sit down with them in confidentiality and collect their stories so that we can find out more about them and what's, how not only Virginia Garcia but the community health center environment has impacted them and improved their lives.
That's a great idea.
Yeah.
Yeah, storytelling is really important these days, and with advocacy on all fronts, we want to give people a voice and a way to engage, and so it'll not only be that, but it'll also be a way for people to sign up on email lists so that we can engage them and include them in our advocacy efforts.
That's great.
Really good idea. Yeah, and it doesn't seem like that is necessarily a heavy lift in terms of setting it up. I mean, you'll need a staff person to kind of interview and work with the patients, but that seems like potentially kind of low-hanging fruit with a huge return. So that's great.
This is Mary Beth. Can you hear me from?
Yes, we can hear you.
Okay, I had to call in. I didn't have a mic on my computer apparently. We're planning to have a patient appreciation day, and as part of it, we'll have a resource, just an internal, so it'll be our own kind of internal health fair for patients, and also wanted to use it as an opportunity to get patient input and feedback. So I really like that idea of collecting stories. Our planning group is actually meeting week after next to finalize things, and I'd like to steal that idea to share with them to see if that might be the format we use for patient input.
Great.
That's our main plan right now, is a patient appreciation day. We'll also be working with our employee wellness committee to talk about kind of staff appreciation event that week as well.
Wonderful. That's great. Thank you for sharing. And it's
Central Civic Concern. Can you hear me?
Yeah, we can hear you, Paul.
Okay. So yeah, I just want to share real quickly what we're doing this year. It's going to be pretty similar to last year. I'm really glad that National Health Center Week has themes, because it really helps us kind of collect our stories that we tell around a specific theme. And so the past 2 years we've done basically storytelling. We haven't had the capacity to do the events during Health Center Week. And I think we would want to do one next year. But we have basically told stories the past couple of years, and we're doing pretty much the same thing again this year. So with this year's theme of health centers as a key to community health, we're kind of taking an interpretive approach to that and showcasing the ways that we go out and bring health into the community through various outreach programs that we have. So we'll be doing little profiles on a couple different programs and telling the stories of how patients have been affected in a positive manner through those programs.
That's wonderful. And how, Paul, can you let folks know how you'll plan to share those?
Sure, yeah. So all those stories, I think we have 4 or maybe 5 lined up this year. They get posted to the Central City Concern blog on our website, which has a nice piece of real estate on our homepage. And then we cross-post everything on our social media. So every time we put a new blog up, we'll have a Facebook post that accompanies it that points them to the blog. We'll have a Twitter post or a couple that'll point to the blog, and then an Instagram post as well. And so we kind of do, it might not be fair to call it multimedia, but we do share it across multiple channels just to make sure that people see this and as many people are exposed to the work that our health centers do.
That's great. And I would encourage you to use the hashtags that NAC has put out that are on their Health Center Week website, and I'll share that website, but that allows them to enter you into picture contests, I think. Being able to kind of filter for those hashtags would be great. So, and since you're doing so much on social media, that's wonderful.
Yeah, and last year we did fine. Actually, the year before too, we found that attaching those hashtags, especially on Twitter, allows NAC to pick up on the things that you post, even if they're not necessarily tagged. And sometimes they'll, I think, just depending on what time it is, they'll retweet that stuff too, so that it gets broadcast out to an even broader national audience.
Right. That's great. Thank you for sharing.
Yeah, you're welcome.
Anyone else have events they're planning or considering, mulling over, questions for anyone on the line who's planned an event?
I have one I forgot about. This is Mary Beth again.
Yeah.
We have a neighborhood group that we participate in that just does planning for neighborhood events and things. And along the street that West Salem Clinic is situated are 4 other social service agencies. So we're having a walking cruise during either the afternoon of either Tuesday or Wednesday, we haven't decided, and inviting neighbors to come and do a little drop-in to each of the social service agencies, including our clinic. And at that time, we'll share more information with them about health centers and the work that we do. So we're coordinating that with other social service providers in our area.
Oh, that's great.
Yeah. It's called a walking cruise. They do one per month, so this one will be a visit of all the health and social service agencies in our neighborhood.
Neat. Anyone else want to share?
Walkout or yeah.
Does anyone have concerns with planning an event? So I will say that also planning something for this week happens to also check off one of the requirements for becoming an ACE or an Advocacy Center of Excellence, which I know many of you were on the call a couple of weeks ago when we talked about that. But this is one of the requirements, and so it can be anything from blog posting to holding a formal health fair. Those all check off that requirement. Okay, last chance to share. Okay, so these, just to kind of wrap up, the tools and resources that I keep referencing that I think will help you are the brand new National Health Center Week website. It's now a couple months old, maybe not brand new, but NAC put that website together. Again, there are things like activities and event ideas, a media toolkit, so resources to contact your local media, social media tools, templates for proclamations, resolutions, invitations, fact sheets, and then some translated materials as well for those of you working with Spanish-speaking populations. Those might be helpful. So there's a lot on this website. I also want to put myself out there as a resource if you're thinking about planning or you want to kind of brainstorm a little bit. I'm happy to jump on the phone with you again. And I will say that we would love to hear as you're planning these events because I am putting together a list to share with not only our state but our federal lawmakers. So we do want to make sure if you're planning something that you get the opportunity to have someone come visit. So your next steps are consider an event. So start kind of thinking through what you might want to be planning if you haven't already. Plan with the team. Build a team not only within the clinic, but also with local partners who might be interested in planning with you. Post to NAC's website and please send us the event so we know what's happening. Reach out to your elected officials and invite them. And again, I'm happy to help with that. They have received a save the date from OPCA, so they should be primed and recognize that that week is National Health Center Week. So at this point, I'll pause. Is there anything in particular that you would need from OPCA or that you could imagine would be helpful from OPCA in order to be successful with this week?
Well, Carly, I'll keep reaching out to you and ask you for help in terms of getting legislators here for sure, elected officials.
Great. That's a big role we can play, and I'm happy to do that. Anyone else have thoughts on how we could be helpful to you? All right. Any other last-minute questions? This was way faster than 1 to 2 p.m. All right. Well, please don't hesitate to reach out. You can call me or email me. We really look forward to hearing about what you're planning and how we can support you.
Thanks, Carly.
Have a great day.
Bye-bye.
Thank you.
Thank you.